I'm Tlotlo Ralefala, I'm a clinical oncologist based in Gaborone, Botswana. I work in Princess Marina Hospital. I'm currently the head of department, and Princess Marina is the largest referral hospital in Botswana. I did my pre-med in University of Botswana and then went on to do medicine in the University of the Free State in South Africa. I came back home and did my internship in Princess Marina Hospital, then went on to work as a medical officer in the oncology unit in Marina. So essentially, oncology services are relatively new in Botswana. I think the unit in Marina is roughly around 20 years now. We have 4 chemo infusion units in the public sector, and we have some chemo infusion units in the private sector, as well as a single linear accelerator in the private sector for cancer care. Just as in other nations where you see a rise in non-communicable diseases, and specifically talking about cancer today, I would say that in Botswana we've seen quite a high rise, or at least more cases that we are seeing in our clinics presenting with cancer. When we started, of course we are not seeing a lot of people, but we didn't have as much as we have now on ground. But I'd still say we still managed to achieve quite a lot. I mean, I worked under a consultant. He was actually a hemoncologist, and I learned quite a lot from him. I mean, ranging from how to do biopsies, for instance, or we do FNAs, for instance. Of course, under his guidance, there will be times when we'll look under the microscope and see whether this is actually a cancer that somebody has presented with or not, and be able to manage our patients well. I must say though that yes, I may have known that I wanted to be an oncologist, but I didn't know what really I wanted to do, you know. For me, it was like, do I want to go into hem-oncology, or am I going to do medical oncology? I remember I sat with this one lady and she was saying to me, you know, you say that you're not sure if you want to treat adults only or children only, or you want to give chemotherapy only, but let me tell you something. There is something that's called radiation oncology, and if you do that, you will actually end up being able to treat everybody. So I thought, oh, okay, that's fantastic. My question was, is there physics there? And she goes, yes. Like, okay, I have to think about it. But anyway, I'm a radiation oncologist now, so clearly I took her advice, which was very, very helpful, because after working in our medical oncology unit for some time, I then had the privilege of going on to specialize as an oncologist, and I actually was fortunate to be in a department that gives both radiotherapy and chemotherapy at the same time. And essentially, when I got back home, I took time to familiarize myself with what was happening on ground again. I found there were new people on ground, so I had to learn really how to work well with everybody. And not only that, I saw that the country, or the unit itself, had essentially also made some strides in terms of cancer management compared to what I knew before I left, which I thought was quite fantastic. And I think from all of this, I've seen that I've grown over time, and I've also learned to now go back and say I need to give back, right? At the moment, I'm with the University of Botswana as an adjunct lecturer there, and I do give my lectures there. And most of the time, what I would do with the undergraduates would be to introduce them to oncology, all the way from the whole continuum of care. You know, the absolute joy I've had now just working with the Ministry of Health and Wellness in coming up with different strategies for cancer care in the country. One thing I had to learn very well was that we can never ever be separate with the population that we are serving, right? So it would be things like, what does the person I want to help think is helpful? So we've recently had a big breast cancer campaign where as the team here in Marina Oncology, we've gone out to the different hospitals that refer patients to us. And we've essentially worked together as healthcare providers in hospitals, in our hospital. It became something where we're like, we are all here together and we need to see how to help each other. Mainly people, of course, like asking me how I've done this, as in like, well, we know the country has agreements. I mean, we've got fantastic partners. We've got academic partners, and we've also have bilateral agreements with various governments, who always then would ensure that at least we always have an oncologist on ground. But that mainly, I just want to say, it came from working with our non-oncology specialists. I had the knowledge, I had the know-how, but they were willing to learn from me and manage our patients. My struggle was people didn't know about cancer. So there I was alone making noise. It felt like being alone making noise. But it took time for people to eventually realize what was happening on ground, and not only just that, for people to also realize that a cancer diagnosis doesn't mean certain death. What really gives me joy is seeing a patient come through my department, knowing that we've actually done the best that we could.